Okay, Dr. White, what exactly is breast augmentation?
It's enlargement of the breast. So a woman who feels that her breasts are too small can have one of the three types of implants inserted, and it makes the breast appear larger.
Is someone not a candidate for breast augmentation?
I think if someone is in good health and has realistic expectations, almost anybody is a good candidate.
So, if you have a young patient that's coming in that has not had children but wants to, should she go ahead and have the procedure? Should she wait? What happens to the breast after pregnancy?
Uh, my philosophy is you should have the breast augmentation when you want it. Enjoy it, and when time comes to have children, go ahead and have the children. What will happen? Well, if the woman chooses to nurse the child, then we're not doing anything that'll keep her from breastfeeding. After she's had as many children as she wants, the question is, what will happen to her breast? If she does not have an implant in, maintains her weight, some women get bigger breasts, some people end up with smaller breasts, some people end up with breasts that droop. That same thing is going to happen on top of the implant.
So, is there a chance that she'll need another surgery then after
She
having children?
might. If her breast drops off the implant, some women would just find that is acceptable. It's just part of getting older and having children. Some women will say they want the breast lifted back up onto the implant. Some women will want to be larger and replace the implant. It's not common, though, to do additional surgery after pregnancy if they've already had the breast implant in.
Well, let's talk a little bit about the procedure. Where exactly do you put that implant?
There are two places the implant can go. One is between the muscle and the breast. The other is to put the implant under the muscle. I think the advantages are putting the implant under the muscle, and that's where I put it almost always.
Does it make a difference if you need later on in life to have a mammogram?
In theory, the implant under the muscle will give you a better mammogram. If you have an implant in, when it comes time to get mammograms, tell them you have an implant, and then they will take 3 views instead of the standard 2.
And where exactly is the incision to put the implant in?
Depends on the kind of implant and where the woman wants it. One of the incisions is just in the half moon crescent under the areola, right at the edge of the areola. That gives us our nicest scar and an incision I like to use a lot. The other incision is right at the crease of the breast. That is an easier incision. I think it doesn't look quite as good as the one around the areola. Some of the implants we have to put in through the lower incision, and some we can use in the upper incision.
And then what type of implants do you use?
There's 3 types of implants. Basically, an implant is a shell filled with something. A saltwater implant, that shell is filled with salt water. A gel implant is a shell, a little bit more complex shell, filled with a gelatinous material. And there's a new implant under clinical trials called cohesive gel implant. That implant is shaped like a breast. It's firmer than the standard gel implant. It's a very good implant. It's under clinical trial right now.
So how do you pick the right size implant for a patient?
We have patients do what we call sizing. They come into the office, they meet with one of our nurses. They put a bra on the lady of roughly the size she wants to be. And they put pads in the bra until she fills out her t-shirt an amount that to her looks good. I get a scientific notation of that size. I think women also want to look good with their clothes off, so they either bring in a picture or select a picture that we have of a naked chest that they think looks nice and proportional. So in the operating room, I will have that picture hanging up. I'll create the surgical pocket, put a temporary implant in there, inflate it to the size we're thinking of. Compare the way she looks to the picture, adjust up or down a little bit, take out the temporary implant and put the permanent one in. And that's the way we can come as close as practical to meeting what's in her mind's eye.
So how long is the procedure?
If all we're doing is a breast enlargement, order of magnitude about 2 hours. That includes going to sleep, doing the surgical procedure, putting the dressings on, waking up and going back to the recovery room.
So what is the recovery like?
That's going to vary from person to person. We recommend someone gets a pain pump. It's a reservoir with long-acting local anesthetic and 2 little catheters about the size of a paperclip wire. One goes in each side and it drips long-acting local, numbing the area, making it dramatically more comfortable. I think people will want to take a pain pill or two the day of surgery. The next day, there are many women that take no more pain pills. There are some just that do. People vary a lot in their perception of pain.
So what is recovery if, I'm a student, if I have a desk job, compared to someone that is a nurse that does a lot of lifting?
If you have a relatively sedentary job, such as a desk job, being a student, minimum 4 days you're not going to feel like going back to work. If you've got this drive to get back to work as soon as possible, 4 days. Most people I recommend take a week off. If you're doing lifting, such as a waitress carrying a heavy tray or a nurse who has to move patients, a minimum of 10 days, maybe 2 weeks to be off of work.
How soon can they return to exercise?
I like people to get back to work, get back to exercise almost immediately. So during the first 10 days, if they're lifting weights, maybe a quarter of the weight they normally do. I don't want them doing things where they strain, such as abdominal crunches. If they're runners, walk. If they're bicyclists, do a stationary indoor bike. But after about 10 days, whatever they feel like. Runners might take a few more days before they feel like running. Outdoor bicyclists can certainly, bicycle weightlifters can then start building up to their usual weight.
Will the implants need to be replaced?
No. As long as the implant is intact, it does not need to be replaced. So a saltwater implant, 3% will spontaneously leak in 10 years. So if that occurs, we replace it. A gel implant, even the old style flimsy implants, I rarely replace. All 3 types of implants have a warranty, so the company will give you a new implant if one should fail.
What do patients tell you after surgery?
Almost always, they love it. Studies have shown that within a month, people incorporate the new breast into self, like they've always had it. Early on, people will say, "Oh my God, these are too big." But at 6 months, the same person will say, "Can you make them bigger?" But most people are very, very pleased with the results.
How soon can you be in a swimsuit?
You can be in a swimsuit almost immediately, probably 10 days before you could get into a swimming pool with clean chlorinated water. Probably need to wait at least 3 weeks before getting into a lake or a river. Need to warn people that immediately after surgery, if you're showing cleavage, that skin might burn a little bit more easily, but after a month that should not be an issue.
When do patients typically feel like wearing something that may be a little more cleavage showing, the sundress?
Oh, variable. Some people almost immediately. I think wearing, getting a softer look and feeling like they want to show cleavage maybe a couple weeks after surgery. That varies from person to person.